Hi, everyone. Thanks for being here with us today. I'm going to be talking about the HIV on-demand testing program, which is alive and well in the interior health region of BC. So we're the second largest regional health authority in the province, and we cover kind of the southern middle part of the province. And we have, I think, 55 municipalities in the region, as well as most of those are small, rural, and many of them are quite remote from the bigger health centers. So the context of this program, and I'll tell you what the program is in a minute, was that in 2013, the Stop HIV program in the province was implemented, and in about the middle of 2014, one of the big things that we were focused on was increasing access to HIV testing within the health region, the interior health region. We had, at the time, a very limited access to healthcare providers and STBBI clinics, and we had a situation where we had overall low testing rates across the region. Certain exceptions were the central Okanagan, where our rates were a little bit higher, but for the most part, it was very much targeted to those individuals maybe who were asking for HIV tests, as opposed to it being something that was more broad-based and available. And at the time, we had focused on the creation of some things called HIV hubs of care, where we were focusing on HIV testing, engagement, and treatment. And one of these particular hubs was in the central Okanagan, and we had an interesting conversation about access to HIV testing. We had nurses available to do testing, but their capacity wasn't great. They were getting lots of new referrals of people living with HIV who needed support. And we had an interesting conversation where somebody, who's actually in this room, do you want to wave? Yeah? Who said, is there no way that we could just walk into the lab and ask for an HIV test? Is there no way we could do that? And fortunately, around the table, in fact, I think there was also one of our infectious disease doctors was sitting there, and he said the same. He's like, maybe could this happen? And we had a lab director from our private lab in the Okanagan who was sitting at the table as well. So this was the cool thing about this particular hub, was that we had a wide variety of people who had the ability to influence services in the region, or in the city anyway, in Kelowna, who actually were there. And he said, I think maybe we could actually set this up where somebody could actually walk into the lab and ask for a test, as opposed to having to see a healthcare provider first. And so then, of course, it was, tasked to me to try and figure out how to actually make it happen. So what is the program? The program is that anyone, and I'll clarify that in a minute, can walk into any lab in the interior health region now and ask for an HIV test without having a requisition ahead of time. So the asterisk for anyone is that at Valley Medical Lab, if somebody is pregnant and they come in and say, can I have an HIV test, they will actually refer them to a local clinic for more comprehensive care, because they determined that that was probably better for that individual, and we didn't disagree. And the second point about any lab is that Life Labs locations in our region are currently not participating in this program, but they provide Get Checked Online. So there are no communities in the interior that have only a Life Labs location, except for maybe Kimberley, where we're about to implement Life Labs, or Get Checked Online. So in any case, it's pretty much any lab that people can walk into. And if someone tests positive for HIV, then they will be linked to HIV care close to home. So it's a partnership between Interior Health and two separate lab services. The first is Valley Medical Laboratories, which is based in the Okanagan, which includes Vernon all the way south to Oliver and Osoyoos, for those of you who are in BC. For those of you who are not, it is our largest population area of the region. as well as interior health lab services. So the program works the same for both lab services, but we got started first with Valley Medical Labs. They were prepared to jump in and help us work through the process, and interior health labs, which cover the vast majority of the rest of the region, slowly decided that they maybe wanted to be part of this. And then only when it became something that actually was really functional did they say, can we participate? So, okay. So we have a centralized ordering provider, Dr. Trevor Corneal. You have to have an ordering provider for the lab. So we have one ordering provider. Trevor happens to be our VP of Population Health as well as our Chief Medical Health Officer. At the time, he was also the lead for the Stop HIV program. So he said, I'm in. I'm happy to be the ordering provider. And we have centralized communicable disease follow-up in our region, which is helpful because we know that anybody who tests positive through this program will be linked to care. And we have really strong post-diagnosis follow-up and linkages to care for HIV within the region. So how does it work? The client decides that he or she wants to have an HIV test and can either print a requisition at home so they can go on to the Valley Medical Lab or the Interior Health Lab system and print a requisition, or they can just go into the lab and say, I understand you have a program and I'd like to have a test. Or they might actually already be in the lab for other lab work and they see a poster that says you can have an HIV test, ask me for more information, and the lab technician will then give them more information about the program. And then the client is given a little bit of information to read. This is a RAC card, a little bit of information about HIV, a little bit of information about how to get tested and how their results will get to them. And then they will be asked to sign a consent that they agree to the program or to having the test. The blood work is then drawn. If the test is negative, then there's no official follow-up, but clients are told at the lab that they can actually phone our communicable disease unit to get their result, and they're asked to wait for 2 weeks just to ensure that the results are there. If the test is positive, because HIV is a reportable condition, it's sent to our medical health officer, who happens to be Trevor Corneal, but it's also sent to Trevor because he's the ordering provider. So we definitely get the results. Then a referral is sent to our health outreach team. Our health outreach nurses are our HIV nurses within the region in whatever community that the client lives. And then the health outreach nurse may work with the family physician because with the interior health process, the result will also be sent to any or any family physician listed in the system, and people need to consent to that. They're informed of that ahead of time. Or if there is no or other physician, then the health outreach nurse will work with the client to link them to care. So uptake, acceptability, and impact. Uptake with Valley Medical alone, there are 13 sites. We have had between 8 and 30 tests per month since we started in April 2016. When we added in Interior Health Labs in the fall of last year, we increased, so our lowest month for tests was 19 and up to just under 50 tests per month. So the uptake isn't huge, but what's really important about this is now if you live in a tiny, tiny community, no matter where you are in the entire region, you can walk into the lab and ask for a test. You don't have to live in that community to ask for the test, so if you don't want to go to your own lab, but you want to drive down the road a half an hour and there's a lab there, you can go there. And that has, we've been told verbally that that is very helpful for people who otherwise may not be able to access tests. No formal evaluation at this point, but clients, as I say, have anecdotally shared with healthcare providers that they appreciate the test, this option. And it is also being utilized by healthcare providers who can't draw blood samples to refer their patients to. So if people are identified as needing, sorry, I'm almost over my time. I'll be really quick. They're referring their clients. Impact so far, we've had one positive HIV test since program inception, so pretty low positivity there. But we know that it's reducing the barrier in our remote regions. And that's it. I thought I was going to say next steps, which is we're looking at thinking about broadening this to other STIs because we know that HIV is not the only thing that people want to get tested for.